If your knees hurt the moment you wake up, stop getting out of bed the way you've been doing it. I'm serious. Those first few steps in the morning where it feels like glass is grinding inside your knee, that's not just stiffness, that's damage happening in real time. And the worst part is, most people think that pain is just what getting older feels like. It's not. In this video, I'm going to show you 5 simple moves you can do before your feet ever touch the floor. You do these every morning, and that grinding, aching, stiff knee pain starts dissolving. Not in months, in days. And you do all of them in bed. Stay with me, because move number 5 targets the one muscle that's secretly destroying your knee, and almost nobody talks about it. Let me explain what's actually happening inside your knee while you sleep, because once you understand this, everything changes. Inside your knee joint, there's a fluid called synovial fluid. Think of it like oil in an engine. When that oil is moving and circulating, everything glides smoothly. Bone moves over bone with zero friction. But here's the problem. When you sleep for 6, 7, 8 hours, you're not moving. That fluid settles. It drains away from the surfaces that need it most. So by the time your alarm goes off, your knee joint is basically dry. I want you to think of your knee like a sponge. A wet sponge is flexible, soft, cushiony, but a sponge that's been sitting on the counter all night is stiff, hard, and if you try to bend it, it cracks. That's your knee at 6 in the morning. Now most people, what do? They swing their legs off the bed, stand straight up, and put their full body weight on a dry joint, and then they wonder why it hurts. That's like starting your car engine in January with no oil and flooring the gas pedal. You're grinding metal on metal. What these 5 moves do is they wring out that dried up sponge and fill it back up with fresh fluid before you ever put weight on it. That's the secret. That's why doing these in bed before you stand up changes everything. Now, most people jump straight out of bed the moment they wake up. That's the worst thing you can do. Let me show you what to do instead. Move number 1. I call this the wake-up pump. You're lying flat on your back, legs straight out. Now, here's what I want you to do. Take one leg and press the back of your knee down into the mattress. Push it down like you're trying to crush something underneath your knee, and hold it 5 seconds. You're going to feel the muscle on top of your thigh, your quadricep, tighten up. That's the muscle that holds your kneecap in place. That's the muscle that protects your entire knee joint, and you just woke it up. Most people walk around all day with this muscle half asleep, and they wonder why their kneecap feels like it's sliding around. This is the fix. Press down, hold 5 seconds, release. Do that 10 times on each leg. This is the exact same exercise physical therapists prescribe the day after knee surgery. That's how fundamental it is. If surgeons trust this move on a knee that was just cut open, imagine what it does for a knee that just needs a little morning help. Try it right now. Wherever you are, straighten one leg, press the back of your knee down into whatever surface you're on, and hold it. Feel that quad tighten. Good. That's your knee waking up. That's move 1.
Move number 2, the fluid flush. This one directly pumps that synovial fluid we talked about right back into the joint. You're still on your back. Bring one knee up toward your chest. Hold it with both hands behind the thigh. Now let your lower leg hang and just swing it gently, like a pendulum on a grandfather clock. Not fast, not forceful, just like gravity do the work. Nice and easy back and forth. What's happening right now inside that knee is exactly what your joint has been starving for all night. Every time that lower leg swings, it's pushing fluid across the cartilage surfaces. It's recoating the bone. It's squeezing the sponge and letting it fill back up. You'll notice something after about 15 swings. The knee starts to feel looser. That creaky, rusty hinge feeling starts to fade. That's not in your head. That's synovial fluid doing its job. Do 15 to 20 swings on each leg. Gentle, rhythmic, like you're rocking a baby to sleep. This is one of the most underrated moves in joint health, and it takes 45 seconds. Now I want you to stay with me here, because move number 3 is something most doctors never show their patients, and it takes 30 seconds. Move number 3. This is called the kneecap glide. And I'll be honest, this one surprises people, because most folks have never been told to touch their own kneecap. But this is something physical therapists who work with professional athletes do every single day. Sit up slightly in bed, one leg straight out in front of you. Make sure the muscle on top of your thigh is relaxed. Now take both thumbs and place them on either side of your kneecap, and gently push the kneecap to the right, then to the left, then push it up toward your hip, then down toward your foot. That's it. You're mobilizing the kneecap. You're breaking up the stiffness in all the tissue that surrounds it. Overnight, that tissue tightens up like a fist closing around your kneecap. This move opens that fist. Now, if your kneecap doesn't want to move much, that's okay. Don't force it. Just gentle pressure in each direction. Over time, it loosens up. If you feel a little bit of crunching under there, that's normal. That's just the fluid redistributing. But if you feel sharp pain, stop immediately and talk to your doctor. For most people, though, this is going to feel like a release, like you just unlocked something that's been stuck. Do 5 pushes in each direction on each knee. Left, right, up, down. 30 seconds and your kneecap is free. Now here's what's going to surprise you. Your knee pain might not even be your knee's fault. Move number 4 reveals the real culprit, and it's a muscle you're probably not thinking about.
Move number 4, the bridge press. And this is where everything shifts, because I'm about to tell you something that changes how you think about your knee pain forever. The real reason most people over 60 have knee pain is not because their knee is broken. It's because their glutes are asleep. Your glute muscles, the big muscles in your backside, are supposed to do the heavy lifting when you walk, when you stand up from a chair, when you climb stairs. But what happens as we get older and we sit more and move less is those glute muscles shut down. They stop firing. And when they stop firing, something else has to pick up the slack. Your knee. Your quadriceps starts overworking. Your kneecap starts getting pulled and jammed into the joint, and you feel it as pain right in the front of the knee. So the solution isn't just to treat the knee, it's to wake up the muscle that's supposed to be protecting it. Here's how. You're lying on your back, knees bent, feet flat on the mattress about hip width apart. Now push through your heels and lift your hips toward the ceiling. Squeeze your glutes at the top like you're trying to crack a walnut between them. Hold it 3 seconds, lower down slow. That's 1 rep. Do 10. What you're doing here is reconnecting your brain to your glutes first thing in the morning. You're telling those muscles, hey, it's time to work today. Stop making my knee do your job. If you've been doing squats and lunges trying to fix your knee and it's not working, this is probably why. The knee was never the problem. The glutes were. This one move done every morning before you get out of bed starts changing that pattern. And I've seen patients come back after 2 weeks of doing this and say, Doc, my knee pain going downstairs is almost gone. That's the glutes taking the load off the knee. That's move 4. Now we're at the final move. This is the big one. This is the one I've been wanting to show you because it targets the hidden muscle that has been silently pulling your knee apart, and almost nobody addresses it.
Move number 5, the 90-90 hamstring release. And let me explain why I saved this for last. Your hamstrings are the muscles running down the back of your thigh. They connect directly to the back of your knee joint. When those muscles get tight, and they get tight in almost everyone over 60 because we sit too much, they pull on the back of the knee like a rope that's too short. Every step you take, that tight hamstring is yanking on your knee joint from behind. That creates compression. That creates pain. That creates that deep aching feeling behind your knee that you can't quite pinpoint. And here's the thing. You can do every knee exercise in the world, but if you don't release those hamstrings, you're fighting with one hand tied behind your back. So here's how we fix it. Grab a towel, a belt, a bathrobe tie, anything long and flexible. Lie on your back. Bring one leg up so your hip is at 90 degrees and your knee is also at 90 degrees, like you're making an L shape with your leg. Now loop the towel around the bottom of your foot and slowly, gently straighten that knee toward the ceiling. You're not trying to get the leg perfectly straight. You push until you feel a stretch down the back of your thigh. That's the hamstring talking to you. Right there. Hold that for 20 to 30 seconds. Breathe into it. Don't bounce, don't yank, just hold and let the muscle release on its own. You'll feel the leg start to give a little bit. That's the tension letting go. That's the rope loosening. That's pressure coming off the back of your knee. Do this 3 times on each leg, and here's my challenge to you. Do this every single morning for 7 days, just 7 days, and pay attention to how your knees feel when you finally stand up and take those first steps. I think you're going to be shocked. Now, let's put this all together, because I want you to actually do this tomorrow morning. When your alarm goes off, don't stand up. Just stay right where you are. Start with the wake-up pump. Press those knees into the mattress 10 times each side. Then do the fluid flush. Swing those lower legs like pendulums, 15 to 20 times each. Then sit up slightly and do the kneecap glide, 5 pushes in each direction on each knee. Then lie back down and press into the bridge. 10 reps, squeeze the glutes at the top every time. And finish with the 90-90 hamstring release, 3 holds of 30 seconds on each leg. The whole routine takes about 8 minutes. 8 minutes before you get out of bed. And those first steps are going to feel completely different. Your knees are going to be warm, they're going to be lubricated, the muscles around them are going to be awake and ready to work.
that grinding feeling you've been living with, it starts fading. Not because you took a pill, not because you got an injection, because you gave your knees what they needed before you asked them to carry you.
Let me ask you something. Touch the front of your knee right now. Just press gently around the kneecap. Is it tender? Is it puffy? Does it feel warm compared to the other one? If the answer is yes to any of those, you especially need this morning routine. Your knee is inflamed, and every morning you've been standing up on it cold, you've been making it worse. This is how we break that cycle. Now, if you made it to this point in the video, I already know you're serious about fixing this. Comment the words healthy knees below so I know you're with me. And if you're watching this and you're thinking, okay, my knees feel better, but now my hips are tight and sore, that's not a coincidence. Tight hips and knee pain are connected, and I made a whole video breaking down exactly how to release your hips. Click right here and I'll walk you through it step by step. I'm Dr. Baylor Scott. Take care of those knees. I'll see you in the next one.